Workforce Development Goal 13 is on policy formation, and who better to talk to than Dr. Pamela Schweitzer, Chief Pharmacists Officer of the United States Public Health Service. Dr. Schweitzer, can you tell us about Goal 13 and what does it mean to you?
Well, for being able to look towards the future, what ends up happening is if we need to have policies that are not only looking at the current time and what our needs are now, but also in the future of what's coming down the pipeline. So for instance, right now we have topic areas like precision medicine, personalized medicine. There's interoperability and technology and all the different new drugs that are coming out and the new needs of drugs and the role of the pharmacist in being able to manage those drugs is going to be changing from now until 10 years from now. So as we prepare our students, as we prepare the students to be into the workforce, they've got to be prepared and have the skills to be able to handle what's coming down the pipeline.
And what kind of workforce development would be of benefit in the public health service area?
Well, of course, you know I love that area, the public health service and public health. And one of the big areas is really looking at population health, looking at data, looking at your communities, and for the institutions and for countries to be able to look at their whole population as a whole and develop strategies to be able to improve the community health instead of focusing on patients just in the hospital. It's going to be a lot more efficient use of our dollars, and it's going to improve the outcome overall. And we really need to, as a society and as a country, move more towards improving our prevention, improving our integration of the healthcare system in the communities to improve the overall outcome in our country.
One of this goal's drivers is the adoption of sound policies and enforceable legislations for a more needs-based approach towards professional development. How do you think countries should approach this driver?
Well, this is an area that's very challenging because you have to be able to align the needs of each country, individual country, with their economic situation, and being able to move quality and to move access to care and just improving the patient outcomes. And usually it takes incentives, it takes being able to invest into the development of the workforce and to make sure that they're trained and that you have a wide variety of all the different areas, the specialty areas that need to be trained and available to be able to handle all of the healthcare needs throughout the countries. So for instance, we're going to need students and professionals trained in a whole wide variety of areas, including scientific studies, new drugs coming out, monitoring those drugs, working in the communities, working in population health, and just managing just a whole population of people. To be able to do that, we have to line the incentives up so the outcomes are rewarded, and so the healthcare system actually moves in the right direction to improve the whole community, the whole nation too, the community health of the community and the nation.
Thanks, Pamela. This is Lena Badr reporting for FIP.